of Charaka Siddhanta in the successful management of Vata Jagratrasi with special reference to sciatica by Dr. K.V. Nalini, third year PG scholar, Department of Panchakarma, under the guidance of Dr. V. Lakshmana Prasad, Professor, Department of Panchakarma, S.V. Ayurveda College, Tirupati. Today I have selected sciatica as it is the most common disease affecting 245 million cases per year worldwide. According to Google Trends also, the sciatica has a twofold increase in search frequency worldwide on the web between 2008 and 2019. In our hospital also, 50% of cases come with Gridrasi Vata for admission. So I have selected this case for discussion today. The term Gridrasi indicates typical gait that resembles Gridra, that is vulture. It is a non-Atmaja Vata Rogya mentioned in almost all classics, in which the patient will be having the symptoms like Stamba, Ruk, Toda, over Spik, Kati, Prishta, Uru, Janu, Janga, associated with Muhuspandata. In addition to the above symptoms, if Tandra, Gaurava, Arochaka are seen, it is considered as Vata Kafacha Gridrasi. This can be compared with sciatica. There will be pain throughout the course of sciatic nerve, which begins at lower back region and radiates up to the outer border of foot. Sciatica is typically caused by irritation of the sciatic nerve due to variety of pathological lesions. In spite of advancements in contemporary modern medicine, it has its own limitation to provide an effective and safe remedy for sciatica. The mainstay of treatment in use are of NSAIDs, surgical intervention, or use of epidural steroid injection. Siddhanta of Charaka. In Ayurveda, Vata is considered as the prime factor that plays a major role in the genesis of many diseases. Vasti is one among Panchakarma therapies, which is the method of administration of medicated decoctions, oils, ghee or milk through anal, vaginal or urethral route. Vasti is considered as the best treatment in non-Atmaja Vata Rogas and quoted as line of treatment for Gridrasi in Charaka Chikitsa Sthana 28 chapter in the verse 101, along with Agni Karma and Sila Vedana. It has been glorified as Artha Chikitsa as it has systemic effect in addition to local therapeutic effect. By subsiding the Vata, all the Vikaras located in other parts of the body also can be allayed, just as by removing the roots of a plant, the stem, branches, leaves, fruits, etc. are also vanished. Though Vasti is considered as the best treatment for Vata, it has its effect on Pitta and Kapha and Samsarga and Sanipata Rogas also. Matra Vasti is a one which has Snehadravya as an ingredient administered to control Vata and has Brahmana effect on Pada, Janga, Uru, Kati and Prishta, and it can be given at any time or any season, which has no rigid restrictions in terms of food and exercise. In Vatavadi Chikitsadhyaya, in the verse 170 to 171 of Charaka Samhita Chikitsa Sthana, Vrishamaladi Taila is said to be used in Sarva Vata Vikara, and it can be administered for Pana, Abhyanga, Nasya and Anuvasana, and emphasized that this is more useful in patients who are broken and shattered by disorders of Vata. This is a unique description given for this oil by Charaka. So this oil is selected for Vasti as Vata Gridrasi is a pain predominant disease. Case study. A 55-year-old female patient was apparently normal before 6 months. She is a housewife doing household work up to 12 to 13 hours per day. She is not a known case of diabetes and hypertensive. One day she had a fall from bike. After that, slowly she developed pain in low back, and after few days it started radiating the left leg. Pain used to aggravate on walking, standing, sitting for a longer duration and on bending, and get some relief by lying down. Then she consulted a neurologist. There she underwent MRI scanning and it has been diagnosed as a case of sciatica. She underwent allopathic treatment for a period of 1 month but not relieved, so she came to SV Ayurveda College Hospital, Panchakarma OPD, and got admitted in the hospital. She is first treated with Sarvanga Abhyanga and Nadisveda for 3 days with Nirgundi Taila and Nirgundi Patra, and followed by 7 days of Matra Vasti with Vrishumuladi Taila. After 10 days of treatment, she her SLRT increased from 45 to 90 degrees and Aberdeen Low Back Pain Disability Scale came down to 2 from 42 out of 100. Roland Morris Disability Questionnaire came down to 0 from 22 out of 24, and her walking time decreased from 24.6 seconds to 10 seconds for 10 meters on an average of 3 times without support. Gridrasi is a degenerative disorder caused by degenerative changes in the intervertebral discs which have no direct blood supply and got nourishment by perfusion and are prone to get damaged commonly. The healthiness of vertebral column is dependent not only on vertebra but also on healthy paraspinal muscles, ligaments, intervertebral joints and good posture. The disc can be compared with Mrudu Asti. So Asti, Mamsa, Snayu, Kandara has to be treated to treat Gridrasi. Vasti is the only treatment which has multidimensional effect and has the capacity of Vatahara and nourishing and rejuvenating property. Moreover, the sciatica is a pain predominant disease. So Vata Vrishamuladi Thaila, which is especially indicated for killing pain, is selected for Matra Vasti. Its ingredients are Vasa Mola, Ashwagandha, Guduchi, Chitrakamola, which has special effect in increasing the blood supply, Rasayana, Vatahara and pain killing properties. On the basis of the result obtained, it can be concluded that the Vrishamuladi Thaila Matra Vasti can be used as an effective treatment in Gridrasi Vata. However, further studies in more number of patients are needed to evaluate the efficacy of the above combination. Thank you.